Unilateral, eco-free, thin-walled ovarian cyst of diameter 4 cm. There are no papillary projections or solid parts, and the CA105 less than 30 units per minute was appropriate management. Repeat TVS in 4 months. Unilateral, eco-free, thin-walled ovarian cyst of diameter 4 cm. There are no ovarian cyst of 4 cm and no malignant features. Appropriate management. Repeat TVS in 4 months. 24. A female has a cancer detected on the at the prevalent round of the NHS breast screening program. Therefore, age she most likely to be 50 years memorized. Okay, and NHS screening program is usually occurred in women aged 50 to 75 years. And female cancer detected at a prevalent round of NHS breast screening program, she is most likely to be age of 50 years. Female cancer detected at the NHS breast screening program, most likely age is 50 years. And NHS breast screening program occurs in 50 to 75 years women. 75. An adrenal nodule of 3 cm short axis diameter is found on post-contrast CT with an average adrenal value of 60 HU. In phase T1W MRI, the adrenal nodule is seen isolated to the spleen, and out of phase T1W, the whole of the nodule returns significantly lower than the spleen. We are most likely diagnosed for this adrenal nodule, adenoadenoma. The adrenal gland has a nodule of 3 cm. And in phase T1, the adrenal nodule is isolated than the spleen, and out of phase T1, the whole of the nodule represents significantly lower signal than the spleen. We are most likely diagnosed for the nodule, adenoadenoma. Question number 76. Known to have uterine fibroids, there has been a clinically apparent increase in the uterine size. There has been a response to a large myometrial fibroid. Therefore, diagnosis will be considered in this patient uterine-sarcoma. The patient has uterine fibroids, and there has been a clinically apparent increase in the uterine size. TVS shows large myometrial fibroid, which therefore diagnosis will be considered in this patient because uterine-sarcoma, because there has been increase in size of the uterine size. So maybe it progressed to uterine-sarcoma. 77. Internal ultrasound shows unilateral fetal ureteric dilatation. Follow-up imaging after birth shows persistent dilatation of a non-porous ureter with aperostatic and distal segment. Most likely diagnosis, primary megaureter. Aperostatic distal segment. FDSA, MAC scan show then congenital PUG obstruction is the diagnosis. But it has aperostatic distal segment, and they did not mention any MAC scan, so the diagnosis is primary megaureter. Follow-up imaging after birth shows persistent dilatation of non-porous ureter that aperostatic and distal segment. Diagnosis, primary megaureter. 78. A stereosalpingogram for infertility. Both fallopian tubes distend progressively with contrast injection but without peritoneal period of contrast. Abdominal radiograph shows continuous distension of both tubes by tense collection of contrast and no peritoneal spillage. Therefore, most likely predisposed to infertility for this patient, pelvic inflammatory disease. The diagnosis is hydrosalpinx. A stereosalpingogram for infertility. Both fallopian tubes, both the left side hydrosalpinx. Both fallopian tubes distend progressively with contrast but without peritoneal spillage, no peritoneal spillage. Abdominal radiograph shows continued distension by both tubes by dense collection of contrast but no peritoneal spillage. Which are most likely predisposed for infertility for the patient, pelvic inflammatory disease is the cause of hydrosalpinx. 79. IVU shows while the left collection system is placed laterally and inferiorly giving a drooped flower appearance, where most likely congenital anomaly, left ureteric duplication, not cross-fluid ectopia. Left ureteric duplication. Drooping lily sign is the most commonly seen in left ureteric duplication. IVU shows the left collection system is placed laterally and inferiorly giving a drooped flower appearance, where most likely congenital anomaly, left ureteric duplication. Drooping lily sign is IVU shows the left collection system is displaced laterally and inferiorly, giving a drooping flower appearance, most likely congenital anomaly, left ureteric duplication. 80. MRI shows circumferential bowel involvement by the placenta, which appears to be continuously within the bowel wall muscle. What is the following is the most compelling reason for follow-up MRI to ensure that placenta involutes for delivery and no abscess has developed. In MRI, the circumferential bowel involvement by the placenta, which appears to be continuous with the bowel wall muscle, we find a most compelling reason for further follow-up MRI to ensure that placenta involutes for delivery and no abscess has developed. Because the placenta is involving the bowel, so we do follow-up MRI after delivery to ensure that the placenta involutes and does not develop any abscess with the bowel. Question number 81. Previously diagnosed bilateral renal calculi is seen with fever, rigors, and left lower pain. Ultrasound shows the dilated left renal collecting system. This following most appropriate management, left nephrostomy, antibiotics. Because bilateral renal calculi he has. Patient is previously diagnosed and has bilateral renal calculi. Then he has fever, rigor, and left line pain. And ultrasound shows dilated left renal collecting system. So this is an emergency. So next most appropriate management is we must do left nephrostomy and antibiotics. Because he has bilateral renal calculi and we have to drain the urine because it is an emergency. He also has infection, fever, rigor, and left line pain. 82. Ultrasound shows intratesticular polycystic heterogeneous mass. This is foreign tumor marker most likely to be elevated. Alpha P reporting and repeated HCT. 8. Ultrasound shows intratesticular polycystic heterogeneous mass. This is foreign tumor most likely to be elevated. AFP and beta HCT because he has seminoma testes, germ cell tumor. So tumor marker to be elevated is alpha beta protein and beta HCT. 83. Female has red androgen levels. Pelvic ultrasound shows bilaterally large ovaries with multiple small follicles. Most likely reason for the patient infertility, polycystic ovarian disease. The patient has red androgen levels, female, and pelvic ultrasound shows bilaterally large ovaries with multiple small peripheral follicles. Most likely reason for the patient infertility, polycystic ovarian disease. 84. With the following features of this renal mass would favor diagnosis of renal cell carcinoma or angiomyolipoma calcification. Because the question there is calcification, they tell you, but 84, they will tell you calcification and angiomyolipoma, that's facts, but calcification is seen in renal cell carcinoma. And the question they tell you, wait, let's see the question. 60-year-old man, 4 cm rounded mass arising on the right kidney. Strong post-contrast enhancement, calcification is also evident. Calcification evident in the tumor. With the following features of renal mass would favor diagnosis of renal cell carcinoma or angiomyolipoma calcification. Calcification will. Because answer B, calcification. They tell you in the MCQ that calcification is evident in the tumor.